Hello everyone. Today topic of my presentation is low vision aids. So what is low vision aid? A person with low vision is one who has impairment of visual functioning even after treatment or standard effective correction and has a visual acuity of less than 618 to light perception or a visual field of less than 10 degrees from the point of fixation, but who uses or is potentially able to use vision after the planning or execution of a task. What are visual dysfunction? It could be a disorder, an impairment, a disability, or handicapped. So, what is visual disorder? It is deviation from normal visual structure by disease, injury, or anomaly affecting vision. And what is visual impairment? It is reduction of visual function results from visual disorder. Visual disability is reduced ability to perform a certain task. And visual handicapped is non-performance of the tasks related to individual and social expectation because of visual disability. So what is basic principle of low vision aid? These are based on the fact that with sufficient magnification, the normal retina surrounding the damaged central retina can be used for central vision. What are types of magnification? Low vision aid make use of angular magnification by relative size and relative distance. What is angular magnification? It is the apparent size of the object compared with the true size of the object seen without the device. Relative size is by making the object appear more bigger, no accommodation is required. In relative distance, by bringing the object closer, it needs good accommodation. What are the indications of low vision aid? In children, there is albinism, ROP, congenital malformation, optic neuropathy, and in young adults, keratoconus, ocular injuries, late manifestation of congenital malformation, and in old age, glaucoma, age-related macular degeneration, diabetic maculopathy, macular degeneration, retinal degeneration, chorioretinitis, optic atrophy, and myopic degeneration. So what are the types of low vision aid? It can be optical devices and non-optical devices. In optical devices, we have magnifying spectacles, hand magnifiers, stand magnifiers, telescopes, intraocular low vision aids, and other optical devices. In non-optical devices, there is approach magnification, lightning, increased size object, electronic magnifiers, writing and communication devices, and orientation and mobility low vision aids. These are the magnifying spectacles. So what is the optical principle of magnifying spectacle? Magnification by a convex lens is obtained by breaking the object within its focal length. An erect, visual and magnified image is produced. Magnifying spectacles have high plus lens to magnify the images. Magnification is 1/4 the power of the lens. Suited for near and intermediate distance, it can be a monocular or binocular. What are the advantages of magnifying spectacles? These hands are free, field of view larger when compared to telescope. Simultaneous near and intermediate vision can be obtained, can be given in both monocular and binocular forms. It is more portable and cosmetically accepted. What are the disadvantages? Spherical aberration is there, higher the power, closer the reading distance. Close reading distance causes fatigue and unacceptable posture. Patients with eccentric fixation are unable to fix through these glasses. Illumination problems. So hand magnifiers indicated for spot or short-term task in patient with field of vision reduced to 10 degrees or more. Available from +4 to +40. What are the advantages of hand magnifiers? Working distance is more, accommodation is not required, easy to manipulate for viewing. Some have light source which further enhances vision. So what are the disadvantages? It occupies both hands, not useful in absence of manual dexterity. Field of vision is limited, need to be held at the correct distance. In stand magnifiers, there is virtual image and short distance behind the lens. The patient needs to place the stand magnifier on the reading material, move across the page to read, as shown in the picture, has a fixed focus. Stand magnifier has advantages that it is technically simple. There are choice for patient with tremors, arthritis, and constricted visual fields. What are the disadvantages? Small field of vision, too close reading posture is uncomfortable for the patient, difficult to use if the surface is not flat. In telescopes, they are used to magnify distant object, work on the principle of angular magnification. Telescopes with magnification power from 2 times to 10 times are prescribed. So what is the optical principle of telescope? It consists of two lenses, in practice two optical system mounted such that the focal point of the objective coincide the focal point of the ocular lens. Objective lens is a converging lens. There can be two types of telescopes, Galilean telescope and astronomical telescope. So what are the disadvantages? Best possible low vision aid to enhance distant vision. And what are the disadvantages? There is restriction of field of the view, depth perception is distorted, loss of light transmission and expensive and costly. So what is approach magnification? Partially sighted patients should be encouraged to move as close as possible to the object. It is called the approach magnification. In illumination, positioning to the side of the better eye, moving light closer. And higher level of illumination is required when there is macular degeneration, glaucoma, diabetic retinopathy, retinitis pigmentosa, and chorioretinitis. Relative size devices, large print material, enlarged clocks, telephones, calendars, computer keyboards, large type playing cards. In electronic magnifiers, closed circuit television or low vision imaging system are available. In writing and communication devices, writing guides, signature guides, check guides, and tactile and raised line papers are available. Sensory substitute assistive devices are auditory substitution, which are talking books, and tactile substitution, which is braille, paperless braille output, and tactile braille output. So there are mobility assisting devices in which patient with low vision suffer a major problem of mobility, so they use long canes and strong portable lights, as shown in the pictures. So there are some newer technology in which there are intraocular low vision aids and keratodontoplasties